at your counseling center, what types of therapy do you offer?
We talk about individual, family, group, couple. We're talking about there in technical terms, unit treatment. Who's coming in for therapy? Is it you and your family, you and your wife, husband, you and your child, your siblings? What group is coming in? What unit's coming in? So all of our therapists are trained to deal with families or individuals or couples. They're all trained to deal with. That's part of our license. What issues are you coming in with? There's a range of issues. So that's more like what we would call kind of presenting symptoms. What's bringing you to therapy? I can't get along with my husband. My wife and I are fighting all the time. My kid's acting out at school. I just had this horrible thing happen to me. I'm struggling with depression. Those are the presenting issues that people come in with. They're pretty human. They're pretty normal. And again, all of our therapists are trained to deal with those. That's part of their schooling and their training here. The type of therapy, what intervention do we use? What do we do? What are therapists trained to do? How does therapy work? There's a whole different number of schools of thought on that. Cognitive-based therapies are very prevalent right now, very supported. In other words, thinking about how you think, looking at your behavior, learning to change that. That's kind of CBT therapy. Mindfulness is very common right now, very big right now. Learning how to be more compassionate toward yourself, learning some meditation, learning how to meet your challenges, issues, problems, traumas with a different relationship. And there's a number of different schools of thought of therapy. It really depends on what that person is coming in with and what they need. And a really good therapist will open up a dialogue with that client. And this is my philosophy of the treatment here. Somebody comes in with issues, problems, and we look at some of the symptoms of presenting issues, not as, what's wrong with you? Oh my God, you have depression and you're anxious and you're drinking too much and you're eating too much and you're fighting, you have all these symptoms, something's wrong with you. Instead, what I train my therapist to do is to listen to that client and say, so tell me what's going on. Well, I'm depressed and I'm anxious and I can't keep my job and I'm fighting all the time. There's the symptoms of what happened to you. So what's going on? What's bringing this all about? So a really good therapy sits and creates a dialogue with the patient. It's very different than medicine. You go in, you get diagnosed, you get treatment. That's when we're dealing with just the body, but when we're dealing with more the emotions, the mind-body experience, it's much more of a dialogue, an inquiry. So what's going on? How can I help you?